Hi guys, so in this next part of the correcting low back pain, knee pain, hip pain video with that lumbo-pelvic hip complex dysfunction. So we've done our release techniques. We're now going to look at doing mobilization. So this will be for all the signs, depending on whether we had knees bow in or knees bow out, or the anterior pelvic tilt. We're going to do our hip mobilization. So this is where these big thick monster bands come in real handy. So I'm going to show you how you do these mobilization techniques. Now with these techniques, what I will say is don't expect to feel an awful lot. You may feel a little bit of easing within the hip joint, but don't expect to feel much. It's not like a stretch or a release where you feel that significant reduction in tension. It's not going to feel like this. What we're doing here is within the hip joint would have, if we did have those signs like the anterior pelvic tilt, the knees bow in, etc. There's going to be reduced space within that hip joint. There's not going to be optimal movement between the hip joint and the hip socket. So what we need to do is try and create a bit more space in that hip socket so that the joint can move more freely and in the directions that it should move. So what we're going to do is we're going to get this big band. I'm going to put my foot. So I'm going to assume if I was doing it on, if I was correcting the asymmetrical weight shift, I would just do the side opposite dysfunction. So if I shifted to the left, I'm going to do it on the right side. Okay, so I said about how you'd release some muscles on one side and activate some others. So you would do this technique on the same side as the muscles you release. So if you shifted to the left, you should be releasing the right side muscles. So you do the right side hip mobilization. But if we just got general bilateral, there's no shift, we're just treating both sides, then you're going to do both sides. Okay, so I'm just going to put it on my right. So my leg, I've put my foot in here, and what I'm going to do is I'm going to pull that band. Ideally I'd have this a little bit higher so it's not going to fall down, but I'll put it around my sofa. So I ideally want this band to be as close into my groin as I can get it, so it's as close into that hip joint as possible. Okay, so I would, if you can, put it a little bit higher, slightly a little bit higher, but I've got it down there so I've got to make use of what I've got. So I'll put that band as high, as close into my hip as I can. Now what I need to do, okay, is make sure, I'm going to come back just a little bit so you guys can see, is make sure that it's nice and strong, it's nice and tight, there's no slack. Okay, so I'm in this kind of quadruped position, or I'm on all fours. So my toes are into the ground, I've got my knees down, I've got my hands underneath my shoulders, so I'm in a nice box position. And what I'm going to do is I'm going to start to rock away from the sofa. Okay, so I'm going to start rocking this way. Okay, so I'm just going to lean in my whole body. I'm not just moving my upper body, I'm not doing this. I'm not just wiggling my hips. My whole body is going to be moving. Okay, so you guys can see, I'm going to pull that band up a little bit more. And this isn't going to work.